Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
Good morning. Proton therapy is the most technologically advanced method to deliver radiation treatment to cancerous tumors available today. The University of Kansas Health System will be the first in Kansas and the Kansas City region to offer proton therapy. Currently, the technology is not available here or in the surrounding states of Iowa, Nebraska, Colorado, or Arkansas. Proton therapy is an advanced form of targeting radiation treatment using protons rather than X-rays to attack cancerous tumors, minimizing radiation exposure to healthy organs and surrounding tissues. This personalized care offers opportunity to more precisely target treatment with fewer short and long-term side effects, depending on each patient's unique condition. And with me to talk about proton therapy and its advantages is Dr. Ronny Rotondo, radiation oncologist at the University of Kansas Cancer Center and director of proton therapy for the health system. Also joining us via his penthouse apartment on the plaza and Skype is Cameron Poindexter to take your questions. I'm Dr. Roy Jensen, director of the University of Kansas Cancer Center. Thanks for joining us for today's episode of Bench to Bedside. So, Dr. Rotondo, could you tell our audience what is proton therapy and how does it work?
Sure. So, first off, thank you for having me this morning and this opportunity. Proton therapy is a form of external beam radiation therapy, and it uses energized protons as opposed to X-rays or photons, conventional radiation, to deliver radiation to the tumor. And so in contrast to photons, which when they interact with tissue, essentially deposit a significant dose in the entrance path to the tumor, deposit radiation dose within the target, but then continue straight across through the other side, essentially leaving a track of potential injury to normal healthy tissue beyond the target. Proton therapy, the energized protons, which have mass and charge, interact with the tissues in a very different manner. And so with proton therapy, there's a relatively lower entrance dose. It then deposits the majority of its radiation dose within the target, and then just beyond it, there's no exit dose. The radiation does not travel further beyond the target. And so what that allows us to do is to really target and focus the radiation in a much more precise manner, concentrating the radiation in the target where there may be a benefit to the patient, and minimizing radiation to the surrounding normal healthy tissues, which has no benefit, and in fact is what may lead to long-term, both acute and long-term side effects of treatment.
So what type of tumors in adults are appropriate for treatment via proton therapy?
So proton therapy in general may be beneficial in tumors which may be in close proximity to critical structures, sensitive structures, where a more focused, precise delivery may be of benefit to limit potential risk of injury. Some examples, some of the more recognized indications include things like ocular tumors, brain tumors, skull-based tumors, which are close to a lot of critical structures like optic chiasm, cochlea, brainstem, spinal cord, which can lead to significant morbidity if there's injury, sinonasal and head and neck cancers, hepatobiliary, and as well, in cases of re-irradiation where patients have received prior radiation. But there's also a number of other areas where there's active exploration and investigation to see if we can leverage these unique physical characteristics of protons to impart a benefit for patients in terms of effects of radiation, long-term effects of radiation and quality of life. And those things include things like prostate cancer, breast cancer, gastrointestinal tumors like esophageal or pancreatic cancer. So there remains a lot of work to further define that list and to identify, which patients benefit the most. But certainly there's a wide variety of patients which may potentially benefit from this type of treatment.
Mm-hmm. So why is proton therapy especially useful in pediatric patients, and what types of tumors in the pediatric population is proton therapy utilized for?
Sure. So that's an area that's near and dear to my heart. That's one of my clinical areas of focus as well as research. And so in pediatrics and children, they are growing and developing, and so they are particularly sensitive to the long-term effects of radiation. And so even low or moderate doses of radiation in children means impact on growth and development. So you can consider, if you have a young child with a pelvic tumor, radiation to the pelvis can impair bone development, growth, and can lead to significant functional issues which would require surgery in the future. So with proton therapy, you can, by delivering the radiation in a much more focused, precise manner, you can limit that excess radiation dose to the surrounding normal healthy tissues and critical structures. And by doing so, you may potentially significantly decrease their risk of long-term effects from radiation. Radiation can also be associated with secondary tumors, so radiation can cause a secondary tumor. And in children who, fortunately, over decades of improvements in therapy may have, improved survival, they are at particular risk of developing a secondary tumor. With proton therapy, again, minimizing the additional radiation dose or decreasing the overall amount of radiation delivered to the body, there's data that suggests we may be able to decrease that risk of secondary tumors by as much as 50%. So if we look at some examples, so certainly tumors of the brain, skull base, spine, which are close to a lot of critical structures, those are ideal types of tumors where we may be able to really significantly impact and offer a benefit. So if you consider a tumor that's close to the optic pathway, limiting that radiation dose to that structure may decrease the risk of vision loss long term. If you minimize the radiation dose to the inner ear, you might decrease the risk of a child losing or having decreased hearing. Similarly, a tumor close to the pituitary gland, which is responsible for a lot of hormone production, including things like growth hormone, which is incredibly important for kids, and also fertility hormones. With proton therapy, again, you might be able to avoid or minimize that impact. If you look at tumors of the chest as well, sarcomas of the chest wall, things like that, again, there's an opportunity there to really limit dose to a lot of those normal organs, particularly the heart or the spinal cord, which can significantly decrease the risk of neurologic disability or cardiac events in the future. Also, tumors of the abdomen and pelvis, like we talked about before, not only in terms of growth and development, but potential injury to those structures, kidneys, in terms of renal function, and again, in terms of gonads or in terms of preserving fertility, proton therapy again may offer some advantage in limiting the radiation dose to those structures.
So why do you believe it's particularly important to bring this technology to the state of Kansas and to the Kansas City region?
So I think it's incredibly important for a number of reasons. One certainly is that as the area's only major academic medical center and the only NCI-designated cancer center, we have made it a commitment to offer our patients the best, most advanced forms of cancer therapy available today here in Kansas City. And so we have a responsibility and a commitment to keep on pushing that. And proton therapy is just another piece of what we were already offering here to advance that. But I think most importantly is that you can imagine, for instance, a family, parents who just learned the diagnosis of their child being diagnosed with a cancer or a tumor, and the devastation that brings, and the worries, and they may be struggling with work, with caring for other kids, may have an elderly parent or something they're caring for, and then they learn that the treatment that's recommended for them that would be best for their child is not offered here, and they have to relocate to another state for 6 or 8 weeks away from their social support network. That's really something that shouldn't happen, and so that's why we felt it's really important to bring it here to Kansas City, so that no family or no patient should have to go through that, and that we can offer the best treatment, individualized treatment for those patients right here in Kansas City.
Mm-hmm. So if you're just joining us, we're here with radiation oncologist Dr. Ronny Rotondo to talk about proton therapy at the University of Kansas Health System. Also, Cameron Poindexter is joining us by Skype to take your questions. And please remember to share this link with people you think might benefit from our discussion. Use the hashtag bench to bedside. Cameron, I believe we have our first question. Is that correct?
Yes, we do. We actually have 2 questions. And the first question is, how would you know if proton therapy is the right treatment for your cancer?
So that's a great question. So we talked a little bit about before some of the more commonly recognized indications, but every case is evaluated separately, and all of the factors taken into account. So it's difficult to say that all patients with X diagnosis will benefit. But what I would encourage is proton therapy is coming to the University of Kansas Health System. We hope to treat our first patient at the end of December 2021. But until then, we remain available, and I'm happy to meet with patients to discuss their particular case and see if that might be of benefit for them. And so what I would encourage is anyone that has a cancer diagnosis in the city and region, that we're here to offer an opinion and to discuss that and all the other options that we have to offer here at our system.
And our second question, Cameron?
Would it be a treatment of tumor in the jaw?
So certainly it can be a consideration or option in that area. In the head and neck area, there are cases where there could be significant benefit in terms of limiting the radiation dose to the oral cavity or to the back of the throat, salivary glands. These are things that might decrease the acute toxicity or effects of radiation during treatment, and potentially also long-term. So there is data in head and neck cancers that potentially proton therapy may decrease chronic dry mouth, issues with swallowing, the need for a feeding tube, and so that again could be a location that may benefit from proton therapy. But again, each case, I think it's important, and that's our approach here, is to evaluate each case independently and to determine which case would most benefit from proton therapy.
Okay, thanks. So Dr. Rotondo, I understand there's an exciting landmark in proton therapy coming up in the next few days?
Yes, definitely. So that's the topping out ceremony. So it's a commemorating a milestone in the construction process, and it's a common practice in the construction industry. But for us, it's really an opportunity to mark this milestone and to really engage the entire cancer center and the health system, because in the end, this is a pivotal project for the Department of Radiation Oncology, but it really extends beyond to all the cancer center and really to our community, the potential benefit of bringing this treatment here. And so if you look out on Rainbow Boulevard, you can see that most of the structure is complete except for the very top last beam. And so that beam is being brought around to the different cancer center sites where employees and patients at those sites have the opportunity to express their gratitude, their excitement, their passion for this project and proton therapy. So that's actually today outside Rainbow Boulevard. So then it will, because of COVID, we're obviously doing this as a virtual ceremony, but we'll have a drone that will be filming and displaying the raising and topping off of this last beam for the structure. And there will be a virtual ceremony, and that will be live streamed on Facebook as well. So I invite everyone to join us for that. And if the beam is in your area, feel free to sign it. And it's also a way to kind of enshrine within the structure, all of the dedication and passion and excitement that our health system has for this project.
That sounds like fun. So, Dr. Rotondo, could you tell us a little bit about your background and your research interests, particularly as it relates to proton therapy?
Sure. So I originally hail from Montreal, Quebec, Canada. So that's where I grew up and where I attended medical school and residency at McGill University. And towards the end of my residency is when I began to decide, or where I first decided that, I was really passionate about treating children. And when I first started to learn about proton therapy, and was really just excited and passionate at that time, and so decided to pursue fellowship in proton therapy. So I first did a proton therapy fellowship at Massachusetts General Hospital in Boston. And then I pursued additional 2 years of fellowship in dedicated pediatric proton therapy at the University of Florida, at the University of Florida Proton Therapy Institute, and where I subsequently remained on as faculty and was treating both pediatrics as well as adult patients, primarily brain and spine tumors, skull base, chordoma, chondrosarcomas, and sarcomas in general. And so those would be, my primary clinical interests, and my research is generally focused on trying to leverage these unique characteristics of proton therapy to try to either improve or to improve outcomes or decrease acute and late effects of treatment, particularly in pediatric and children and young adults in those sites.
Mm-hmm. So could you tell us why it's important for proton therapy to be located at an academic cancer center, an NCI-designated cancer center?
Sure. So I think that's really important because the NCI designation really is represents the investment and commitment that we have and the resources to conducting cutting-edge clinical basic science translational research. And in proton therapy, we know that there's growing data that for certain sites, there seems to be a significant benefit, but there are a lot of questions that remain unanswered, trying to determine which patients benefit the most, which patients may not. There are opportunities in terms of exploring how to combine proton therapy with other treatments or systemic therapy, immunotherapy, and also a lot of technological questions. And so being part of an academic center, NCI-designated cancer center, really allows us to play an important role not only in providing outstanding state-of-the-art clinical care to our patients, but also pushing the limits in terms of trying to improve outcomes and through research and pushing the field of proton therapy forward.
Mm-hmm. So just stepping back, why do you think it's important for a cancer patient to seek care at an NCI-designated cancer center in general? not just radiation therapy.
Sure. So I think, radiation therapy is just one component. I think when, again, the NCI designation is something that comes through a rigorous review process from the National Cancer Institute and really reflects, our outstanding commitment and the resource investment in basic science, clinical research, and that therefore opens to patients access to a whole array of clinical trials, national trials, local, regional trials, but also some trials which are initiated here at our institution are only available here. So it gives patients access and opportunity to participate in these cutting-edge clinical trials, again, to try to push the outcomes and improve care. But it also means that you're coming to a center where you're not just meeting, the highly specialized radiation oncologists, but it's a whole team approach with surgeons and medical oncologists, surgical radiation oncologists, pathologists, radiologists, all of these members of the team, which are highly specialized and meet to discuss each case in a tumor board setting, so that we're sure that we make the best individualized treatment recommendation for that patient. And so they, again, benefit from all of that expertise and the breadth of all the clinical expertise and research that we do here.
Mm-hmm. So any additional questions, Cameron?
We currently do not have any additional questions at the moment.
All righty, thank you. So, Dr. Rotondo, what would you most like our listeners to take away from this session this morning?
So what I would say is that proton therapy is a form of external beam radiation therapy that is very focused and very targeted, and it's the most advanced form of radiation therapy available. It's coming right here to the University of Kansas Health System. We hope to start treating patients by the end of next year, so December 2021. That there's a significant number of patients, so proton therapy may not benefit all patients, but there's a significant number of patients which can significantly benefit from proton therapy. And so if you are diagnosed or know someone who has a diagnosis of cancer and would like a second opinion, I would just encourage everybody to come get an opinion so that we can evaluate your case and see if proton therapy may be a benefit for you.
All right. Well, thank you very much, Dr. Rotondo. That's it for today. To learn more, please visit kansashealthsystem.com/proton therapy. Join us next time for Bench to Bedside. Thanks for watching.